Hello, everybody. In this presentation, I would like to tell you about the Kids Strengths Project, which was an initiative, a European initiative focused on children who might be forgotten in the care systems because they don't necessarily have any problems, but they are living in families where their parents are suffering from heightened mental health vulnerability, mental health illnesses. So that's the topic for today. Think about how this relates to what you already know, maybe about young carers or about the systems of support that you are familiar with, how we're supporting families. The changes that happen in families due to mental health difficulties happen over time and are causing a lot of stress to children. So research shows that it's actually chronic stress that children are experiencing if their parents have mental health vulnerability, if they suffer with mental illness or addictions, which are part of that category of mental health difficulties. If people start having problems with their mental health, it takes a long time for them to realize that, to understand and to admit that maybe it's a good idea to look for help. And then once they actually reach out, it can take a while they get help and start feeling better. So because of this long duration of the process, children are living in chronic stress. It can take years for parents to get help with their mental health. And chronic stress happens already after 3 to 6 months in living in difficult situations. So what this chronic stress, how it's heightened or when it's becoming more serious, it's when it takes long. When there are some hidden symptoms that the parents' mental health illness or mental difficulties are not exactly showing, right? So nobody knows what's exactly going on, and the symptoms are hidden, and that makes it more difficult to address. Some parents with schizophrenia, for example, might lack a sense of reality, and that's very difficult, especially for young children. Families may suffer from social isolation, either because of the stigma of mental health vulnerability, or because the condition makes the parents not want to be initiating contact or be involved in social situations. Children are experiencing a lot of unexpected situations where all of a sudden the parent is not available, emotionally or physically unable to do something in the house, and that's difficult. That's contributing to the stress. Relationships can be unstable in families with mental health illness, either because of the condition or because the partners are not really sure what's happening with their partner in the family. It can also be that the topic is still stigmatizing in the family and that the wider family is ignoring it, doesn't want to talk about it, and that's contributing to higher stress because the children need to understand that somebody acknowledges that the situation is not maybe regular or that there is some support needed. So what happens then with children is that they take on different roles of how they deal with the family situation, of how they make sense of it and how they live their lives, how it impacts their behavior. What we can see in their behavior are these different roles. So some children might be acting as heroes. Everything is perfect. I'm doing well at school. I will even do better because I want to show that everything is okay and that I can do this. So they're very, very resilient, but it's also like a coping mechanism that they are overcompensating with their excellence. So it's very important to have a look at high achievers. If maybe there is something they're compensating for that, we actually need to support them even though they are doing really well. Then there is a role that's described as handsome baby. It's maybe a little bit of a strange translation from German from Germany, because this project started there, or this is where it's been identified in the research. And that refers to children who regress developmentally. So they start acting as if they were younger, maybe to get that emotional support, or to, to feel safe, to feel that they're still being taken care of. Scapegoats are those children who start engaging in some difficult, challenging behaviors, maybe even dangerous behaviors, joining some groups that are on the edge, and where they are really showing us with their externalizing behavior that something's wrong, that they need help. And actually, usually these children get the most help, because their behavior is addressed, and it's discovered that something's going on. So in a sense, they sometimes engage in very dangerous situations, but they do get help. Then another role is the clowns, the children who make everything look like fun, and they entertain everybody in the family, and they kind of trying to cover up that there is something going on. And then there is the last type of children that we are calling the forgotten child, because they don't show anything. There are no symptoms. There's nothing in the behavior, how we could tell from the outside that something is going on in the family. And that's the most difficult one to recognize, right? Because there's no way we would be able to tell that the child needs support. So why we're talking about this topic is to become aware that there are these forgotten children who seems to be doing just fine, but they could really use some support. So what are actual children's needs? If you think about Maslow's hierarchy, some of this really fits in, and that's the feeling of safety. But children also need appropriate information and understanding of their parents' mental health difficulties, because they can see it, right? So they need information about what is happening, and they want to be helpful. They want to feel that they can do something for the parents, for the family. So they need the tasks that would be age appropriate. We're not pushing them to be the heroes, but we're giving them some challenges how they can help, even if that's just bringing an apple, if that's just making breakfast once a week. We are not asking them to do it all the time, not to take on the parental responsibility, but to be able to contribute and feel useful and helpful. And so parental mental health vulnerability, mental health illness affects the partner relationships and their parenting style, and that has an impact on the child's adjustment. There's a research study about these processes and how it affects children, girls and boys in different ways. And what we know from psychology about coping mechanisms, it really matches that boys show more of those externalizing behaviors and girls more of those internalizing potentially. So they maybe turn the difficulties into themselves and kind of try to sort it out within themselves. This is a snapshot of the project website. So everything I'm talking about you can find here. It's quite an old website, but it's useful to go to the resource pool where I'm clicked on right now, and just click on the resources in English. And then you can open the first ones for health professionals, let's say. And then there are the modules which include different documents with research and talking about the roles of children, that's in module 3. Talking about resilience of children is in module 4. That's a very interesting document to read. Some of the research and the beginning of the importance of the topic is in module 2. And then I will talk about module 1 in a little bit, that explains a specific program of how to work with parents in these situations. So let's talk about Children. It's a program that was developed in Finland. And it's a series of focused conversations of professionals. And this can be non-medical professionals, so even teachers, daycare workers, anybody who is in everyday contact with the families, because they often notice that something's going on. The child comes late to school or doesn't come, or is dressed in a strange way, and we need to explore what's going on. So having a conversation with the family can really help, but sometimes professionals don't know how to approach it, what is an appropriate way to talk about mental health. So in this parental questionnaire, there are a series of questions for parents with children in different ages. So from infancy, kindergarten, through primary, secondary school age to adolescence, to focus on different areas of the child's life and to talk about it with their parents, and to talk about how they think their illness is potentially impacting their children. And what is nice about the program is that it really focuses on the strengths in the families. It identifies vulnerabilities as well, but anything that works normal, that works well, is considered a strength. And I think that's really, really important in empowering families, that it's okay, we can manage this, but let's think about what the children might need in these situations. Right? Because psychiatrists often just talk about the patient, and the patient is the adult, but how often do they actually ask about, do you have children? How is the family life? Has anything changed? Do you need support in the family life? This is an example taken out from the parental questionnaire. So in a conversation, the professional can go through this completely transparently, filling it in together with the parents, and marking it either as a strength or as a vulnerability, and then setting goals of what can be done around those areas. It also prepares the parent and helps them to think about how they will talk to their children about their mental health. And I wanted to give you an example of something very practical that can be done to help children in these situations. And it's called first aid letters, or we can even have first aid boxes where there can be some objects that children can access when they are feeling stressed. And when they see that maybe the parent is going again into an acute phase of their mental health illness. So when it's getting worse, or when they really are observing something's going on and maybe the parent is not aware of it yet. So it's really used also for people with schizophrenia, with bipolar disorders, with a very severe mental health illness. So who are these letters for? They are first aid letters for children. So they're addressed to the child. They're created by parents. We can, as professionals, we can write it together with the parents. We can help them in creating them. We create them definitely when the parent is doing well, right? Not in a crisis situations, but when they are doing well and they can have that insight and prepare for potentially that situation happening again. That's when they can prepare these letters for their children. Of course, if children can't read yet, then maybe we need to use a different format, easy words, pictures, or we can identify somebody who can read the letter to the child. Or maybe we could do an audio one, a recorded one. Okay, they are for emotional emergency. So how to kind of cope with a stress situation that happens. And as we go through the content, you will see sort of where it's going. They can be used so the child can access them when they're feeling that the stressful situation is coming, and then they can contact potentially other people who can help the family. Because what often happens is that families with mental health vulnerability might not be complete families. So maybe that the only adult that's around with the children is the adult with the mental health vulnerability. Right? So what they're suggesting, and these letters were created as an intervention technique by Katja Beck, who is the founder of an organization in Germany called Netz und Boden. And they are, so they have a whole program of mentoring that is like a civilian community support, where the family gets mentor, like a grandparent or somebody from the community, that went through checks and trainings and so, but it's not necessarily a professional in the field, and they volunteer and provide a support person for these usually single parent families with a mental health vulnerability. So when a crisis happens, the child has somebody to contact. Okay, so in these letters, in the beginning, they're suggesting that parents should express that they are sorry, explain the visible symptoms. So maybe, so I'm sorry that we are going through this again, that I'm not feeling well again. You might be observing, you might see that I'm staying on the sofa the whole day because I can't really make myself get up. That is due to my mental health illness or to my mental health difficulty. It's supporting child's intuition is the next step. So really making sure that the child is observing it right, because sometimes the parents can't see it, that it's coming. Expressing empathy, that I know that it's really hard for you right now. Giving recommendations of what to do next. So maybe who to contact, or, just keep going to school, keep doing your homework. I will catch up with the house duties when I'm feeling better. Support child's independence. So tell them what are the things that they can do by themselves. What are the things maybe they don't have to worry about. Definitely tell them who they can turn to, who to talk to. Either stick to your sister or contact grandma or something like that, and the way of how to contact them. Express hope for the future, that tell them that there is hope, that this will go away and I will get better. The doctors will help me. And remind them of some good times. Like, remember when we went for ice cream together, we will do that again. Support their self-esteem. Even if I'm not feeling well and I am maybe not smiling and not nice to you, this is not your fault. And it's due to my illness, and that will go away. You're doing great. You're an amazing daughter. You're an amazing son. And express love in the way you do. I love you, or whatever, however you express love to your children. That's the way how you can end the letter. So it's just an outline. And as professionals, we can encourage this and write it in a session with parents together. So there's just something practical that came out of the project and it was shared across, and that is practically used, so it works well. Okay, so where can you find all the resources about the project? It's all on the website that I showed you. It's called strongkids.eu, strong-kids.eu. And then in the resource pool, there are all the documents. I would recommend a film called The Illustrated Mom. That is a story about a mother with two daughters that has a bipolar disorder. So the phases of mania and depression swap in her life, and how that affects the family life and the children. It's a little bit sad, but it's a really powerful and beautiful movie. And there are some references here. Thank you very much for listening.